What was your first exposure like to palliative care?
My first real exposure to palliative care was when my grandmother was diagnosed with acute myeloid leukemia on a Saturday and then ended up passing away the following Friday. They were so amazing at guiding us and holding our hands and helping us to ask my grandmother those really tough questions that none of us felt comfortable in asking.
Do you remember what some of those questions were that they helped you ask that you guys maybe wouldn't have asked on your own?
Basically, what is it that you want right now? What is most important to you right now? She was able to answer, I just want to die peacefully and quietly, and I don't want chemo, I don't want radiation, I don't want a bone marrow transplant, I don't want anything. Just let me go, and I want my family here and make sure I'm as comfortable as possible. And she died a beautiful, peaceful death. And then about 9 months after she died, I went in for just routine physical, and my doctor said, I think that you have leukemia. So they were able to figure out that I had a specific type of chronic myeloid leukemia. I got started on chemo right away. There was no other option. So probably within my first hour of being in the hospital, the palliative care team walked in, and I worked with them, and I knew them from my grandmother. And so seeing them walk in just caused so much panic. And I felt horrible because I loved them, and I actually really revered Dr. Michael Carney as a big deal in the palliative care world, and almost yelling at him like, I'm not ready for palliative care. And he said, that's fine, don't worry about it. He was like, I just want to make sure that you have all of your questions answered and that you're comfortable. And, if you have any symptoms, please, we'll walk with you through this. So they came and saw me every day in the hospital. I continued to actually be followed by them on an outpatient basis because I was having a lot of issues with long bone pain and nausea. And they were amazing at controlling my symptoms. And I was eventually able to return to work within a matter of about 2.5 months.
Wow.
I am so grateful for them. And so having had both experiences where my grandmother was terminal and we had accepted her dying process, and being guided with palliative care through her experience, and then through my experience where I wanted to continue to pursue aggressive treatments yet still be comforted. It was really amazing to know that palliative care can make such a difference and really ease the way and make people comfortable, not just physically, but emotionally and spiritually. And I'm so grateful that I had them on my team.
How has that changed your practice as a nurse and how you approach patients who have serious illness?
It's made me a lot more sensitive to our patients and where they're at. It's always such a good reminder that while our patients are dying, they're still living. And recognizing that and making sure that the life that they're living is the best possible, whether that means that they're going to die in a manner that they want to die in or don't want to die in. Just trying to think about how can we make this better for them?
What do you hope for? What's thinking about your, palliative care, nursing? What are you hopeful for in your career and in the future?
I'd like to see bedside nurses get better educated in what palliative care is so that all of our patients can receive it without them even knowing it. We as nurses have such an incredible opportunity to bear witness to what our patients and our families are experiencing. And so I want nurses to feel empowered to do what we do. And so I have a lot of hope